Hello, Namaskar, and a very good evening to all the viewers watching our session. This is Simran Singh, and you are all watching us on PM eVidya channel number 6212. You can connect with us through various mediums, and one of them, as you all know, it is our YouTube channel, that is ncertofficial. So it's around 5 PM on your watch and regularly from Monday to Fridays. For this half an hour, that is from 5 PM till 5:30 PM, we come up with our special sessions known as Sahyog, guidance for mental well-being and psychosocial support for all the students and viewers watching our sessions out there. So here we come up with certain important and interesting topics for all our students. So today we are going to discuss about addressing social anxiety in adolescence. Now this is the most talked topic of today's scenario, and it's very important to talk and mention about such issues like social anxiety, depression, mental breakdown among adolescents, and today it has become more important than ever. Therefore, we are also joined by two experts to provide us more guidance in this session. Allow me to introduce them to all our viewers. In the conversation we have with us Dr. TV Somshekhar sir. Namaskar sir.
Namaste, namaste.
Welcoming you in the session. Sir is a faculty at Regional Institute of Education, Mysore. Then we are also joined by practicing counsellor from Mysore, Miss P.V. Manjula ma'am. Namaskar ma'am.
Namaste.
A very warm welcome to you as well, and welcoming all our viewers in this session with open arms. You all know the different mediums through which you can connect with us, and one of them is our contact number that is flashing on your screens. So feel free to reach out to us at this number, that is 8800440559. And also a specific mail ID for Sahyog is again flashing on your screens. It is sahyog.ncert@ciet.nic.in. So let's begin our conversation on how to address social anxiety, especially among adolescents. So the first response I would like to have from Dr. Somshekhar sir. So what is social anxiety and how is it different from general anxiety and shyness? And at the same time, what are the causes of social anxiety among adolescents?
Okay, that is a good question, pertinent questions. Since adolescence is a transitional stage from childhood to adulthood period, we know that this transition phase is a very stressful and traumatic condition for the individuals to pass through. And since because parents also doesn't treat them as child, not treat them as an adult, so they are also in a conflicting situation. Therefore, even adolescents feel that in that stage, identity crisis exists more, and they want to establish their own identity. So it is creation of their idea of self. So when they are want to develop their self ideology and self concepts and self-actualization abilities among them, so they need to empower all their inner strength and abilities, and also express those abilities in a social platform in a very meaningful manner. So when they want to express it socially in a different platform, in different context, then they may able to face this social anxiety. So social anxiety itself is talking about where there is interactions of people, more than 2 or 3 in a group or in a team, then the individual may able to face these kinds of social anxiety. And social anxiety and social phobia, they are the two terms we are trying to use it interchangeably, but there is a slight change. The change is the specificity in the situation in which the individual has the stress factor that is triggered off in that condition. So that is the specific situations will enable us to classify them, whether it is a social anxiety or is it a social phobia. But in common parlance, we use them as interchangeable terms. So what is that social anxiety disorder? So it is a condition characterized and marked by persistent fear of being humiliated and being under the screen or under the scanner by others. So that means you believe that whatever your actions are, your ideas are, your expressions are, is subjected to vigilance and observations by others. So when you become very conscious of all those activities, then you try to have a withdrawal tendencies, and these characteristics in a social setup, in a social platform, if it is shown consistently, we call that as social anxiety disorder. But what exactly is the social anxiety? So it is the individual feelings about his nervousness, intense nervousness, and becoming self-consciousness about his actions. And here he may be thinking about the pre and the post of his actions. So that is, he's trying to say what would happen and how it will happen and what could be the outcome. So if you are thinking about all the consequences in advance, and thereby you become more nervousness, and therefore you may not be having that social courage to face them to the expected level. And that too exclusively when you are interacting with the group, that too when you want to have one-to-one interaction with the group or one-to-one meeting with any other individual persons, then the characteristics of nervousness and becoming self-consciousness is the significant factor of social anxiety. So that means that anxiety is there in every individual, which will be there, but when you are trying to express it with other person, when you want to have eye-to-eye contact, then this social anxiety comes into the picture. Now let us see what are the differences or the symptoms of social anxiety disorder. Okay, so since you don't want to have face-to-face interactions or establish eye-to-eye contact and express your ideas, you want to avoid it, so therefore you try to escape from the situation. That will be your first and foremost defense mechanism that you like to have it. But some may overcome this strategy and then they say, no, let me face the social platforms and try to say what will be the consequences, but still their body and mind does not cooperate. In that context, we may say somebody experiencing muscle tension and pain in their body, exclusively around their neck, they can feel that, and even you may feel that whenever you want to speak, you are not able to speak in normal way, you will be trembling and you will be making mistakes in your communications, in pronouncing of your words, and even you will feel that there is a lump in your throat where you cannot produce your sounds very clearly, and even you will have the blushings on your faces, and even you start sweating as a factor of your anxiety. And even you can feel that your heartbeat has suddenly increased. It is not normal. So therefore you are in a position to feel your own heartbeat in that particular pattern or in situations. And you can also feel that your hands and legs are shaking. So that means here you are not able to control your body. Your body and mind is not in a very controlling manner, and therefore you feel the trembling or shaking in your body. And sometimes even you may feel that you have stomach ache and you have dizziness, and then at the last you may also say that why should I face these kinds of situations, so let me avoid that. So avoidance tendencies will also come into these pictures. So these are the symptoms if any individual has, or if any team has at your homes. The parents can take a note of this and try to see how best they can able to overcome these kinds of symptoms. The next is, we talk about how this social anxiety is different from shyness and from general anxiety. So how is that shyness means here? It may appear. So it is a kind of withdrawal tendency temporarily in a given situations. Okay, it may disappear when one gets used to a situation and becomes familiar with that situation. So when it is unfamiliar, only in that particular instance you may show this tendency of shyness. Otherwise, you will become familiar with that, and that can be temporarily avoided. And even shy people are more optimistic. So that means here they have a possibility that yes, this time I have failed, next time I will do it better. So these kinds of optimistic views are already there with that, and they are not self-critical as those suffering from social anxiety. So these are not so extreme, they are only minor. At that minor point, they will trigger and they will disappear. And that these kinds of people doesn't need any medical intervention. So there is no medications or medical treatment, medical therapies are required. The shyness appears at some point of time, or a period of time, with the input from the parents and from the encouragement, motivation from others, it can be eradicated. Whereas social anxiety, it may either remain unchanged or get worsened, even if the place and people become familiar. So that means you have to say that though the people and the place become familiar to you over a period of time, but still you may continuously have these kinds of tendency within you. And sometimes there may be change in your anxiety levels or in your tendencies that may happen. And people affected with social anxiety are usually pessimistic. So that means here they feel themselves and they don't want to express those feelings outwardly into the world. So they are inward people, introverts, and therefore they don't want to express their ideas and tend to overanalyze simple situations. So that means here they think about the consequences to the larger extent which is not required. Okay, they should analyze it to the nearest point, but they go beyond the point and also try to look at the consequences to your far-reaching situations, and thereby they become more self-consciousness, self-awareness is there, and therefore they try to show all kinds of withdrawal tendencies. Whereas for such people with the social anxiety disorder, so there are certain kinds of medical interventions that can be given and which helps them to overcome these kinds of self-disorders. Whereas general anxiety, as we say that every human being has an anxiety, anxiety at the normal level help us to do work in a very positive directions, and it is a must. So it occurs in a day-to-day situation, it is not in a peculiar situation or unfamiliar situations. So these are the normal situations which every one of us are having these kinds of general anxiety, and they don't require any kind of medication. Only requirement is that whatever we are trying to do it, the actions that we want to perform it, that needs to be more organized. So that means we need to introspect what is that we want to do and how we want to do it. So it is in those contexts, if you analyze and organize yourself in more effectively, then you can overcome that general anxiety to a larger extent. So next we talk about what are the causes, are the risk factors which causes this social disorders. The first and foremost factor that we may consider or we may likely to say is the genetic factor. It is the hereditary factor, so in which the chromosomes of the parents which flows through in terms of RNA, DNA, and those characteristics may be from father or mother, one of those traits may be there, and that may also trigger these kinds of social disorders. So it is only 1 out of 3 persons and less than 30% of people are subjected to these kinds of genetic disorders. Okay, and next is observing others, other people who are having social anxiety disorder. If any child observes the elder person exhibiting these factors, and if they embrace that as a role model, and if they try to imitate it, try to embrace it, even they also tend to affect by these kinds of social anxiety disorder. Then it is early traumatic events. So that is during the childhood or in the early childhood period or in the later childhood period, if the child has been abused and it is pushed into this traumatic condition, and those experience the child carries forward into the adolescent stage also, then also the child is exposed to social anxiety disorder to a larger factor. And the next factor is the parenting style. So as we are now moving towards the nuclear family, and now we are also seeing that, so there are child rearing practices by the single parents. So even this also has an impact on the child. So even if the nuclear families also, both father and mother, if they are overprotecting the child, not allowing the child to be more adventurous and do independent activity, and try to protect him in all kinds, in all forms, in all ways, then the child doesn't have opportunity to explore and do any work independently. So those kinds of overprotective parenting style also causes more of social anxiety disorder. And as I said that now we are in the nuclear family and both parents, father and mother are going for work and try to enhance their economic status, and in that way the child is left alone at home, and this child has to grow on its own. So therefore isolated upbringing of the child either through mentoring or monitoring by the caretakers or caregivers by as an alternative method, also has an influence effect on the child upbringing. So therefore, even these kinds of upbringing of the child will also has an impact on the social interaction the child faces as the child grows, and therefore it also the one of the causes for the social anxiety disorder. And the thing is the brain that we have, every one of us has, and the kind of functioning that has a certain part of brain, how it reacts to this anxiety situation will also trigger the social anxiety, because a particular hormone and the adrenal will push the blood forward to causing these anxious moments, and therefore the functioning of the brain also to a certain extent causes some social anxiety. And lastly, it is the societal expectations. We are living in a society, and the society expects each one of us to exhibit the social norms and the practices that the society has evolved. And if the society also demands a child to reach to that expectation, and if the child feels that if he is not exposed to these social interactions, is not exposed to social exhibition, or is not exposed to any of the social events in any social platform, then is not able to meet the levels or expectation of the societal norms and practices. So these are the factors which causes the social anxiety disorders. And if we are able to identify these causes and risks to a larger extent at the initial stage and try to provide the alternative measures for all of them, then I think to a certain extent we may be able to overcome the social anxiety disorder to a larger extent.
Yeah, thank you so much, sir, for this valuable piece of information. Now, after that wonderful explanation, we can make out that what is social anxiety, what is social anxiety disorder, and how does it different from the general anxiety or the shyness that we feel among adolescents. Thank you so much for that. But here is an important question in front of us whenever we talk about social anxiety. Now, how can we overcome and how can we combat this feeling of social anxiety? Any strategies, any piece of advice from your end, Manjula ma'am?
Thank you, ma'am, for the question. When we talk about strategies to overcome social anxiety, we really need to understand if it is social anxiety or social anxiety disorder. Both the terms are often used interchangeably. So according to Diagnostic and Statistical Manual of Mental Disorders, DSM-5, social anxiety, if is persistent for more than 6 months, it is called as social anxiety disorder. Now, when it is social anxiety disorder, the treatment involves psychotherapy and medication. Now, all of us have social anxiety in various situations, but it is not persistent and prolonged. It is situational specific and short in duration. So we need to know certain strategies to overcome social anxiety. Here are some of the strategies. So if you are in a situation which is causing social anxiety, suppose you want to give a speech, or you are in a new school, you are admitted into a new school, then you will feel tensed, you will feel dizzy, or you will feel like you are sweating, okay? You may be having suffocation. So how to overcome all these situations? What you have to do in such situations? You have to gather your strength, breathe in, hold your breath for a moment, and breathe out through mouth. I repeat, you can do it with us again. Breathe in, hold your breath, and breathe out through your mouth. When you are breathing in, empower yourself with the positive thoughts. And when you are breathing out, throw the negative thoughts from you. So this is one of the strategies which you can follow in your daily routine life also. It can be followed in your daily practices. The second strategy is training yourself to face the situation and not to avoid it. So some of the methods are like gradual exposure to the situation, step by step exposure to the situation. You have to analyze the situation, you have to find the reason for anxiety and work on it. For example, you want to go to a party, you are being invited to a party, but you are having anxiety facing public, facing people in the party. So priorly you have to plan, you have to schedule a meal with your friend or with your family member, going to a restaurant or going to a hotel where you are exposed to public situation. You are exposed to public eating. You can extend yourself, interact with the people in such situation, and then you have to go to the exact situation. You can participate in group activities. This will enhance social skills, techniques of interpersonal and intrapersonal skills of interaction. Professional therapists often employ similar techniques of cognitive behavioral therapy and exposure therapy and group therapy for individuals suffering with prolonged and persistent social anxiety. Let us see some general measures for improving the ability to address social anxiety issues. As aptly said in Bhagavad Gita, Yukta Hara Viharasya, one need to focus on their diet. They're eating junk foods, avoiding caffeines. You have to avoid caffeine-rich food. You have to avoid junk foods. This will reduce the anxiety. You need to have at least 8 hours of sound sleep every day, every night, so that you can be anxiety-free. Exercise should be there in your daily routine. Yoga, breathing exercises, muscle relaxing exercises should be there in your daily routine. If you can foresee the situation, you have to work out for the remedies. Step-by-step exposure to the situation will familiarize you with the situation and will help you in getting acquainted with the situation, and this will also reduce your anxiety. Suppose you are in a situation which is very anxious, which is causing anxiety in you. You will be having lot of negative thoughts. What you have to do at that point of time? You need to write down all the negative thoughts, and below that you need to write down the positive thoughts which are challenging the negative thoughts. So you have to work on that again. And many of us, we all know that when we hear to good music, or when we eat some delicious dish, or when we smell some fragrance, when we smell some perfume, we feel relaxed. So you have to use your senses sometimes, the sound sense, touch, smell sense, to relax yourself when you are in stressful situation or when you are in an anxious situation. Now, when you are in an anxious situation, you have to take the focus off from yourself. You need to focus on your own strengths rather than your weaknesses.
Yes, Manjula ma'am, surely you are discussing about certain important elements, brief and minute details for our viewers, but due to paucity of time, I'll have to request you to please conclude your words.
Yes. Then we, as teachers, what we can do? We have to be supportive, and we should not be judgmental. We have to structure our classroom activities, and we have to allow our students to select their partners when we are grouping the children. We have to assign a classroom buddy so that they will support such children. We have to let students know in advance if we are going to ask questions the next day, so they will come prepared. If some students is willing to rehearse, we should help them, encourage the students to participate in their fullest. And we have to be patient and positive as students are learning ways to cope up. We have to involve all the relaxation activities like breathing activities in our daily classroom routine situations. We should encourage anxious students to speak for themselves, identify quiet places for them to rest when they are overwhelmed, and we should modify the class schedules according to their needs. And we should have regular meetings with the parents, with the counselors, and with the school staff, so that we can empower the student in a better way. And we should, if possible, we should find an alternative place for them to eat their lunch.
And yes, ma'am,
And
I'm
as
pretty sure that
parents,
our
we
viewers
have-
would take a note of that.
Yes.
Yes.
Yeah, as parents, we should be modeling the situation. As sir has said it in the he already said it in the causes. We should be empathetic. We should cater to their basic needs like giving good food, encourage good sleep. We should not be overprotective. We should expose them to social situations in a step-by-step fashion, and we should seek help of professional whenever it is required without any stigma. So these are the strategies we have to follow.
Yes, ma'am, I do think that turns out productive for all our viewers watching this session. We would have loved to continue the session, but due to paucity of time, I'll have to wrap it here itself. Thank you so much, ma'am, for being a part of this conversation and leading our path through how to address social anxiety among the adolescents. Thanks a lot. And thank you so much, Dr. Som Shekhar, for being a part of this conversation, enlightening our viewers about important elements of information. Thank you to both the experts. Thank you to all the viewers who have connected with NCRE for this particular session. Now it's time to wrap up our Sahyog session, but you don't have to go anywhere because we'll be right back within few minutes with another session. So stay connected to NCRE and keep watching PM eVidya channels. Namaskar.